The emergency room fell silent the moment he pointed at her. Marcus Voss, billionaire, defense contractor, the kind of man who bought entire hospital wings, looked at Nurse Emily Carter like she was something stuck to the bottom of his shoe. "Get her out of my room," he said. "She doesn't belong here." Nobody argued with him. Not the charge nurse, not the administrator who materialized in the doorway, not Dr. Victor Hale, who smiled like he'd been waiting for exactly this moment. Emily Carter picked up her chart and walked out. 40 minutes later, Marcus Voss was dying. His body was shutting down in ways the entire trauma team had never seen before, and the only person in Redwood Crest Military Medical Center who knew how to stop it was the woman they'd just thrown out of the room. If this story already has you hooked, stay with me until the very end. And hit like, subscribe, and drop a comment telling me what city or country you're watching from. I want to see exactly how far this story has traveled. The morning started the way most mornings started at Redwood Crest, with someone underestimating Emily Carter. It was a Tuesday in late October, the kind of cold Denver morning where the mountains sat flat and gray on the horizon like cardboard cutouts, and the hospital's automatic doors breathed fog every time they opened. Emily had been on since 6. She'd already handled a construction worker with a nail through his palm, a 17-year-old with a seizure, and an elderly woman who'd fallen off her porch steps and fractured 2 ribs. Normal morning, steady work. She was charting at the nurses' station, the one near the supply corridor, not the main desk, because the main desk had a clear sightline to Dr. Hale's office, and she had learned 2 years ago to stay out of his peripheral vision when she heard his voice behind her. "Carter?" She didn't turn immediately. Finished the sentence she was typing first. "Carter? I'm talking to you." She turned. Dr. Victor Hale was standing 4 feet away with a tablet in one hand and the particular expression he saved for her. Not quite contempt, not quite amusement, something in the middle that made her feel like a math error someone hadn't bothered to correct yet. He was 53, silver-haired, the kind of good-looking that had curdled slightly with age and arrogance. He'd trained at Johns Hopkins. He mentioned it often. "The Delacroix woman in room 6, he said. "She's asking too many questions about her discharge medications. Go talk her down." Emily blinked. "She's asking questions because her discharge instructions list metoprolol, and she has a documented sulfa allergy." "She doesn't have a sulfa allergy. It's in her file." "Then the file's wrong. Go talk her down." He walked away before she could answer. Emily stood there for a moment, then pulled up the Delacroix chart on the nearest terminal. The allergy was right there, listed, flagged, confirmed on admission. She paged the attending pharmacist, documented the discrepancy, got the medication corrected, and then went and had a perfectly normal conversation with Mrs. Delacroix about her actual discharge instructions. It took 20 minutes. It prevented a serious adverse reaction. Nobody thanked her for it. That was fine. She hadn't expected them to. Emily had been at Redwood Crest for 2 years, 3 months, and approximately 11 days. She wasn't counting. She just had a decent memory. And in that time, she had developed a precise, calibrated sense of where she stood. She stood below Dr. Hale, obviously. She stood below most of the attending physicians. She stood, in the unspoken social architecture of the hospital, somewhere between tolerated and invisible, which was a position she had not exactly chosen but had learned to work with. She was 31, medium height. Dark hair she kept pulled back in a low knot. She didn't wear much jewelry because jewelry caught on things and she moved fast. She had a small scar on her left forearm that she never explained and a habit of going very still when she was thinking hard, which some people read as blankness and which was not blankness at all. Her nursing school evaluations had called her precise and methodical. Her performance reviews at Redwood Crest called her capable and reliable. Both of these were accurate and both of them missed the point, the way a review of a river might accurately note that it is wet. She had a 1-bedroom apartment 12 minutes from the hospital, a cat named Rook, who had opinions about everything. She ran 4 miles most mornings before her shift, through the park near her building where the cottonwoods dropped yellow leaves in October, and the paths were quiet enough that she could think. She didn't have many close friends at the hospital. She wasn't unfriendly. She was just careful, in the way that people are careful when they've learned that certain things, once said, can't be unsaid. There were things about Emily Carter that her colleagues didn't know. Not because she was secretive, exactly. more because nobody had ever thought to ask, and she had never volunteered. The resume she'd submitted for this job listed 2 years of emergency nursing at a Level 2 trauma center in Tucson, a nursing degree from University of Arizona, and a blank space where some people put hobbies. It did not mention the 4 years before the nursing degree. It did not mention Kandahar. It did not mention the call sign she'd been given by a group of special operations soldiers who would have laid down in traffic for her, and one of whom actually had once, in a sense. That was a different life. This was this life. She went back to charting. The call came down from administration at 11:14. Emily heard it first through the usual channel, Donna Reyes at the charge desk, who had a way of distributing information that functioned like a controlled burn, letting people know exactly as much as was necessary and in precisely the order that caused the most efficient disruption. Donna was good at her job. She was also, Emily had observed, slightly afraid of Dr. Hale, which was a common condition at Redwood Crest. "We're getting a VIP admit," Donna announced to the nurses' station at large. "ETA 40 minutes. He'll need a private trauma suite." "Who is it?" asked Priya Okafor, one of the newer nurses, without looking up from her chart. "Marcus Voss." A pause. Even Priya looked up. Marcus Voss was not a name you didn't know. Not in Denver, not in any city that touched the defense industry, which was most of them. Voss Defense Technologies had government contracts worth more than some states' annual budgets. He appeared on the covers of magazines. He had a building named after him at 2 universities. He was, at 58, the kind of man who existed at a scale that made most people feel slightly unreal by comparison. He was also, according to his incoming medical brief, experiencing recurring episodes of chest tightness and autonomic instability that had been partially managed by his personal physician but were now apparently not responding to that management. Emily read the brief when it came through. She read it twice. Something about the symptom cluster nagged at her. The particular combination of cardiac involvement, the vascular irregularity, the fact that his personal physician had tried 3 different medication approaches and none of them had held. It didn't fit a clean cardiac picture. It fit something else, something she'd seen before, in a context so removed from this hospital that it took her a moment to pull the thread. She flagged the brief and left a note in the intake system suggesting that an autonomic function assessment might be worth adding to his workup alongside the cardiac panel. Then she went to prep the trauma suite they designated for him, because that was her job. She'd been in the suite maybe 10 minutes, checking the crash cart, confirming the monitoring setup, doing the methodical inventory that kept her hands busy and her mind sharp, when Dr. Hale appeared in the doorway. "Carter?" "Dr. Hale." He looked around the suite with the expression of a man who'd arrived at a restaurant and found someone sitting at his table. "Who assigned you to this case?" "Donna put me on prep. I assumed I'd be covering." "You assumed wrong." He said it pleasantly, which was somehow worse than if he'd said it with an edge. "I'll need Martinez or Park on this one. Or Okafor. She's been looking to build her critical care hours." Emily kept her face neutral. "Any particular reason?" "Voss is a major donor to this hospital. He has expectations about the level of care he receives. That means attending-level presence for every procedure, clear communication at every step, and nursing support that—" He paused, and the pause did a lot of work. "Projects the appropriate image." She'd heard variations of this before. What it meant, stripped of the professional phrasing, was that she was too quiet, too unimpressive-looking, too unremarkable to stand in the room with a man like Marcus Voss. It was the kind of thing that was impossible to argue against directly because it was never stated directly. "I'll let Donna know," she said. She finished the inventory, documented the cart, and walked out. She was at the nurse's station updating a different patient's chart when the motorcade arrived, 3 black SUVs pulling up to the private entrance, which she could see from the window if she turned her head, which she didn't. She could hear it, though, the particular change in ambient noise when someone important entered a building. Lowered voices, quicker footsteps, a quality of attention that pulled the air in a different direction. Marcus Voss came through the doors in a wheelchair he clearly resented, flanked by 2 men who were built like they'd been assembled from spare linebacker parts and dressed like they were going to a job interview. His personal physician, a small, precise man named Dr. Emmett Foray, walked beside the chair with a leather medical bag and the look of someone who had been awake too long and was trying not to show it. Emily observed all of this from her peripheral vision and then returned her attention to her chart. Priya Okafor drifted past her station. "He's kind of terrifying in person," Priya said under her breath. "Most people are." "Did you see the security guys?" Emily had. She'd also noticed that one of them moved differently from the other. A slight favoring of the right side, compensation through the hip that suggested an old injury, the particular gait of someone who'd spent years adjusting around damage that had never quite healed. She recognized the walk. She'd seen it on a lot of men in a very specific set of circumstances. She didn't say any of this. She finished her chart. The first 40 minutes of Marcus Voss's admission passed without incident, which Emily registered because she had a habit of registering the texture of quiet periods. They were never uniform, and you could usually tell what kind of disruption they were preceding if you paid attention to the right details. Dr. Park had been assigned to cover, with Martinez on secondary. Hale floated in and out, doing the thing he did when there was a powerful person in the building, which was position himself in sightlines and speak in a slightly louder voice than usual. Emily could hear him through the suite door when she passed. Something about the hospital's surgical technology, something about outcomes data, the particular register of a man selling himself to a man who hadn't asked to buy anything. She was redressing a laceration in exam room 3 when the first real signal came through. Not a code, not an alarm, just a change in the quality of the noise down the hall. A door opened harder than it should, footsteps with urgency in them. She finished the dressing, secured the bandage, told her patient she'd be back to check on him, and stepped out. The hallway had that particular charged stillness that preceded a crisis in any clinical environment. People moving fast but trying not to look like they were moving fast. The barely contained current of something going wrong. She saw Martinez almost running toward the Voss suite. She saw Park's face through the window of the suite door, and what she saw on it was the expression she recognized as controlled panic, which was panic that hadn't yet decided whether it could afford to show itself. She walked toward the suite. A hand came down on her shoulder before she reached the door. "Not your case, Carter." Dr. Hale, standing in her path with the particular solidity of a man who had never once doubted his right to occupy space. "What's happening?" she said. "Voss is experiencing some instability. Park and Martinez have it." "What kind of instability?" "The kind that's being handled. You're not needed here." She looked past him through the suite window. She could see the monitoring equipment from where she stood, the waveforms, the numbers, the particular way the lines were moving. She looked at them for 4 seconds. The pattern. It hit her like stepping on something in the dark, sudden, specific, flooding her with a certainty that she had no good way to explain to anyone in this hallway. She knew that pattern. She had seen it before in a context so entirely removed from this fluorescent lit corridor that the two things existed in her memory like photographs from 2 different countries. But the body didn't lie, and the pattern didn't lie, and what she was seeing on that monitor was not a cardiac event. It was not a standard autonomic crisis. It was something specific and rare and treatable if you knew what it was, and extremely dangerous if you treated it like something else, which was exactly what Park appeared to be doing. "Hale," she said, "that's not a cardiac event." "Excuse me?" "Look at the waveform, the QRS morphology, the pressure oscillation. That's not ischemic, it's not arrhythmic. The autonomic pattern combined with the vascular compression he was already showing on admission. Carter, if they push the vasopressors they're reaching for right now, they're going to make it significantly worse." Hale's expression went from condescension to something colder. "You are not on this case. You are not a physician. You are a floor nurse who has been told, clearly, and more than once, that she is not needed here." "I know what I'm seeing." "You know what?" He stepped closer, and his voice dropped, and it was quiet in the way that things are quiet when they've decided they don't need to be loud anymore. "You have been a problem at this hospital since the day you arrived. You second-guess attending physicians. You override medication decisions that aren't yours to make. You document discrepancies in cases that aren't your cases. I have been patient with you. Dr. Hale, but I want you to understand something very clearly. There are nurses who have careers at this hospital, and there are nurses who don't, And right now, standing in this hallway, challenging me in front of... The alarm went off. Not the rhythmic, periodic kind. The sustained kind. The flat, continuous shriek of a monitor that had stopped finding what it was looking for. Hale spun. Through the suite window, Emily saw Martinez lunge for the crash cart. She saw Park's mouth moving, saw him calling out orders she couldn't hear through the glass. She saw Marcus Voss on the table, eyes half open, the gray-white color of a man whose body had just decided to stop cooperating. She didn't think about Hale. She didn't think about her job, or the warning he'd just issued, or the careful, measured way she'd spent 2 years and 3 months navigating the particular political geography of this hospital. She pushed the door open and walked in. Tong. The suite was loud in the way that resuscitation rooms get loud. Controlled chaos, everyone talking at once, the crash cart open, and Martinez already drawing epinephrine, because that was the protocol, and Martinez followed protocol the way some people followed religion. "Don't give him the epi," Emily said. Martinez looked up. "What?" "Don't give him the epinephrine, not yet." "Carter," Park said, his voice carrying the particular edge of someone trying to maintain authority over a situation that was sliding, "this is not your... I know it's not my case." She was already at the bedside, already reading the numbers, her hands moving to check pulse quality at 2 points simultaneously the way she'd been taught by a flight medic in a forward operating base, who told her once that your hands were smarter than your textbooks if you let them be. His systolic is dropping, but his MAP is actually holding. That's not cardiogenic. Look at his neck. Carter, look at his neck. Park looked. Martinez looked. The distension was subtle, not the dramatic presentation you'd see in a textbook image, but there, real, the kind of thing you missed if you weren't expecting it. "Suspected obstructive shock," Emily said, already reaching. "Tension variant. The vasopressors will increase afterload and make it worse. He needs... You are not authorized." She was already doing it. What she did next was fast and quiet and very specific. It was not a procedure in the Redwood Crest Protocol Manual. It was not something taught in standard nursing training, or for that matter in standard medical training. It was something she had learned in a tent in Kandahar from a combat surgeon who had a philosophy about field medicine that could be summarized as, "The patient doesn't care what's in the manual, so you shouldn't either." Her hands knew the angles. Her hands knew the pressure, the depth, the exact quality of resistance to expect, and what it meant when you found it. Her hands moved with a certainty that had nothing to do with this hospital, and everything to do with a version of herself that she'd thought she'd filed away somewhere quiet. The monitor changed. Not dramatically. Not the cinematic flatline to normal sinus that happened in movies. Gradually, in the way that real bodies responded to real interventions, the numbers began to shift. The pressure curve altered. The waveform found a different shape. Park was staring at her. Martinez was staring at her. The 2 security men who had followed Voss everywhere and were now standing in the corner of the suite, because of course they'd followed him in here because that was what they did, were staring at her. Marcus Voss himself, from behind eyes that had gone from half open to fully, suddenly, completely open, was staring at her. "What?" he started. "Don't talk yet," she said. "Give your body 30 seconds. He gave her 30 seconds. She counted them internally, the way she'd always counted them, because counting was something your brain could do while your hands were doing something else, and it kept the panic from finding a foothold. At around second 22, his colors started coming back. At second 30, he took a full breath. Emily stepped back. Her own hands were steady. They were always steady. She'd been told this was unusual. She'd stopped being surprised by it, and she became, in that moment, aware again of the room around her. The monitors, the people, the specific strange quality of silence that descends when something impossible has just happened in front of witnesses. Park said quietly, "What did you just do?" She was about to answer when the door to the suite opened. Not a nurse, not an administrator, not Dr. Hale, who was standing visible through the doorframe with an expression she had never seen on his face before, something unmoored, like a man who'd just checked his footing and found nothing under him. 4 people in the doorway. Civilian clothes, but the bearing was unmistakable to anyone who knew what they were looking at. A posture that came from years of being the most dangerous person in whatever room you occupied. And at the front of the group, a man in his mid-40s with close-cropped hair and a face that Emily Carter recognized the way you recognize a song you haven't heard in years, immediately, completely, with a complicated feeling you don't have a word for. He looked at her. She looked at him. Commander Nathan Brooks said, "Nurse Carter," and the entire room went very, very still. The name landed in the room like something dropped from a height. Commander Nathan Brooks said it again, quieter this time, the way you say something when you want to make sure the other person knows you see them. Not performing, just acknowledging. "Emily." She held his gaze for exactly 1 second. Then she looked back at Marcus Voss, checked his pulse at the wrist, read the monitor, made sure the numbers were still moving in the right direction. They were. She stepped back from the bedside and pulled off her gloves and dropped them in the bin by the door, and only then did she turn fully to face the doorway. "Commander Brooks," she said. His expression was doing several things at once, none of which were simple. There was relief in it. Not the soft kind, but the kind that comes after a long time of not being sure, a relief that had some wear on it. There was something else underneath that, something she wasn't going to name in this room. "You know each other?" Park said. He was looking between them with the expression of a man whose model of the situation had just been replaced by a significantly more complicated one. "We've worked together," Brooks said. He didn't elaborate. He looked at Marcus Voss, and something passed between them. The particular look of people who share a context that doesn't translate to civilian settings. Marcus. Voss had been watching all of this from the bed, color still rebuilding in his face, breathing more even now than it had been 4 minutes ago. He looked at Brooks. He looked at Emily. He looked back at Brooks. And when he spoke, his voice had the roughness of a man who'd just come back from somewhere he'd almost not returned from. "Nathan," he said, "you want to tell me who this woman actually is?" "In a minute," Brooks said. "How are you feeling?" "Like I need someone to answer that question." Brooks moved into the room. His team, 3 people, all with the same quality of contained readiness that Emily had spent 4 years living alongside and 2 years trying to forget the feel of, spread out with the casual, automatic efficiency of people who didn't need to be told where to stand. One of them positioned near the door. One at the monitoring equipment, eyes moving over the readings with the focused attention of someone who actually knew what they meant. Dr. Hale stepped into the room behind them. "I don't know what's happening here," Hale said, and his voice was doing something she'd never heard from it before. It was uncertain, which should have felt like satisfaction, but mostly just felt like information. "But this is a restricted medical environment, and I need to understand who authorized this access." "Dr. Hale." Brooks turned to him with the particular quality of attention that senior military people had, the kind that made you feel simultaneously seen and small. "I'll need you to give us a few minutes." "Excuse me?" "A few minutes, please." Hale stood there. She could see him trying to calculate who this man was, what authority he represented, whether the political cost of complying was higher or lower than the political cost of refusing. He was used to being the most powerful person in a room. He was not used to that being wrong. He left. Emily noticed that Martinez left with him, close to his shoulder, loyal in the way that certain people were loyal to certain other people without fully understanding why. Park stayed. He stayed because Park, whatever his other qualities, was the kind of doctor who wanted to understand what had just happened to his patient, and that instinct overrode most other things. She respected that about him, actually. "Sit down, Marcus," Brooks said. "I'm in a hospital bed." "Then stay there." He pulled a chair to the bedside and sat, leaning forward with his forearms on his knees. The posture of someone who had delivered difficult information in difficult places enough times that he'd found the position that worked. "Your symptoms. How long has this been building?" 3-4 months. Foray had it managed, or I thought he did. Foray wasn't treating the right thing. Brooks glanced at Emily. She stayed where she was, near the monitor. She'd moved to the edge of the room the moment Brooks arrived because that was where she'd been going since the day she left. Toward the periphery, the margin, the place where she could see everything without being what everyone was looking at. "The symptom pattern he came in with," she said, addressing Park more than anyone else, because Park was the one who needed to understand it from a clinical standpoint, It's consistent with a condition we saw in field environments. Autonomic dysregulation secondary to sustained high-stress exposure, plus a specific class of medication interaction, the kind that doesn't show up in standard cardiac workups because it doesn't originate there. Foray was treating the downstream effects. He wasn't catching the source. Park was quiet for a moment. That's not in any standard differential. No, she said. It's in a DoD field medicine report from 2019 that isn't publicly available. Another silence. Marcus Voss was looking at her with an expression she was having trouble categorizing. Not the dismissal from before. That was completely gone, replaced by something that looked like a man running a rapid reassessment of a situation he thought he'd understood. You were in the field, he said. It wasn't quite a question. For a while, she said. Which unit? Brooks answered before she could. That's not information we're sharing in this room, Marcus. I know what that means, Voss said. He held Emily's gaze. I know what that means, and I need you to understand that I owe you an apology. She wasn't ready for that. She'd expected the question about her background, the reassessment, maybe an acknowledgement that the earlier dismissal had been wrong. She hadn't expected the directness of it, the lack of hedging. Voss was a man who was used to managing how he appeared. Right now he wasn't managing anything. Don't worry about it, she said, which was not exactly acceptance and not exactly deflection, and was the best she had at short notice. I told them to remove you from my room. You did. I didn't. He stopped, started again. I assumed based on another stop. I was wrong. I'm telling you I was wrong. She nodded once. I heard you. She looked at the monitor. Your numbers are stabilizing, but we need to adjust the medication protocol for the next 12 hours, and I want someone watching your pressure curve continuously, not on a 30-minute check cycle, continuously. She said this to Park because it was Park's case and it needed to be Park's call. Park nodded slowly. I'll stay on. She believed him. The hallway outside the suite had the particular atmosphere of a place where something had just happened, and everyone knew it, but nobody was saying it directly. Nurses moved with slightly altered trajectories, finding reasons to pass close to the suite door. The two security men who hadn't gone in with Brooks stood by the private entry, shoulders back, expressions arranged into professional neutrality that didn't quite cover the attention underneath. Emily went to the supply station at the end of the hall and stood there for a moment that was not doing anything in particular. She was aware that her hands, which were always steady, were still steady, and that there was something happening behind her sternum that she couldn't currently afford to examine, so she didn't examine it. She'd thought about what it would feel like to see Nathan Brooks again. She'd thought about it more than she'd admitted to herself and less than she probably should have. She'd imagined it as something with more time around it, some context, some preparation, something that wasn't a hospital suite with a dying patient on the table and an audience of people she worked with. She hadn't imagined it at all, actually. She'd just not thought about it. The way you don't think about certain things when not thinking about them is the thing that lets you function. Donna Reyes appeared at her elbow with the expression of someone who had been watching the last 2 hours from the charge desk and had clocked everything. You want to tell me what just happened in there? Donna asked. Medical intervention on a patient in distress. Emily? I'm fine, Donna. I know you're fine. That's not what I asked. Donna looked at the suite door, then back at her. Those men who came in. Military? Some kind of federal response team. Connected to Voss? Connected to the situation, I think. I don't know the specifics. Most of that was true. Donna studied her for a long moment with the particular discernment of a charge nurse who had spent 22 years learning that when people said they didn't know specifics, there were generally 2 reasons, and only one of them was actual ignorance. She seemed to decide, for now, not to push it. Hale is in his office, Donna said instead. He's been on the phone for the last 15 minutes. Emily processed this. Who with? Don't know, but he's using the door-closed voice. She knew the door-closed voice. It was the voice Hale used when he was managing something he didn't want documented. She filed that. I'll be back on floor in 5, she said. She went to the bathroom at the end of the hall, ran cold water over her wrists for 30 seconds, looked at herself in the mirror without particular judgment. She looked tired. She usually looked tired. That was fine. She thought about the moment the monitor changed, The moment his pressure started coming back, that particular quality of relief that she would never fully describe to anyone, because it wasn't the relief you could talk about easily. It wasn't warm or triumphant. It was just the absence of a specific terror, which was its own thing entirely. She dried her hands and went back to work. By 3 in the afternoon, the story had moved through the hospital the way stories moved through hospitals, imperfectly, in fragments, accumulating details that were sometimes accurate and sometimes not, but that collectively assembled into something that resembled the truth from a distance. The version Emily heard secondhand from Priya, who'd heard it from one of the day shift nurses in the cardiac unit, was that a nurse had performed some kind of unauthorized field procedure on Marcus Voss, and either saved his life or almost killed him, depending on who you asked. The version circulating near administration involved a federal response team and some ambiguity about whether Redwood Crest had a credentialing issue. The version closest to true, that a nurse with a background nobody knew about had correctly identified a rare and dangerous condition and intervened when the attending physicians hadn't. That one wasn't circulating at all, because it required knowing things that most people didn't know. Emily spent the afternoon doing what she usually spent her afternoons doing: charting. Wound care. A patient with a suspected pulmonary embolism that turned out to be confirmed. She made sure the right people knew in the right order. A teenager with a broken collarbone who was more upset about missing his lacrosse tournament than about the bone, which was actually a reasonable set of priorities given his age. The ordinary human business of injury and repair. Around 4:30, she was flagged by one of Brooks's team, the woman who had stood at the monitoring equipment, whose name Emily didn't know, but whose manner suggested a background similar to her own, and told that Commander Brooks would like to speak with her when she had a moment. She had a moment at 5 when her shift technically ended. She found him in the small family consultation room at the end of the East Corridor, which was either a coincidence or the result of someone knowing which spaces in the hospital were private without being official. He was standing at the window when she came in, which was where she'd have stood too. He turned when he heard the door. He looked at her for a moment that was slightly longer than a professional moment, and then he said, "You cut your hair." 3 years ago. "It looks good." "Nathan." Her voice came out more tired than she intended. "Why are you here?" He acknowledged this with a slight shift in expression, the way he always acknowledged things that were direct, not negatively, just noting them. Marcus has had federal security details since last quarter. There's been a situation developing around his company, around certain contracts. When his health status escalated, the detail flagged us. "Flagged who specifically?" "My unit." He paused. "We've been aware of his location for the last 72 hours. When the medical alert came in this morning, we were close." "That's not the whole answer," she said. He almost smiled. Almost. "No, there was also an intelligence flag on Redwood Crest that we were already monitoring, and when Voss was admitted here specifically, it accelerated our timeline." She was quiet for a moment. "A flag on the hospital. On a specific physician at the hospital." She looked at him. He said it carefully, the way he said things when he knew they were going to matter. "Victor Hale has a relationship with a procurement contractor that has federal implications. Some of his patient outcome decisions over the past 18 months have been not coincidental." The air in the room changed quality. She thought about Mrs. Delacroix and the medication error that wasn't an error. She thought about every time she'd documented a discrepancy and felt the documentation disappear into a system that didn't seem particularly interested in it. She thought about the specific, purposeful way Hale had pushed her out of Voss's room and wondered, not for the first time, but now with a new and colder framework around the wondering, whether that had been about her at all. "You think he was managing Voss's care," she said, "directing it. We think he was making sure certain information about Voss's condition didn't surface through standard channels. Whether that was for financial reasons or because someone was directing him, that's what the investigation is working out." "Who's running the investigation?" "Joint Task Force. DOD and Federal Health Oversight. They've been building the file for 4 months. He looked at her steadily. "Your intervention today changed the timeline. Marcus is going to recover, and when he's well enough to be debriefed, What he tells us is going to move things along significantly faster. You're saying I accidentally accelerated a federal investigation. I'm saying you saved a man's life, and the rest of it is a consequence. He paused. That's what you always did. She looked away from him, out of the window. The mountains were still gray. The cottonwoods in the park she could see from here had gone from yellow to bare in the week since she'd been paying attention. I'm a floor nurse, she said, at this hospital. That's what I am here. Emily, I'm not saying that like it's a complaint. I'm saying it like it's true. I've built something here. It's small and it's quiet, and I know it doesn't look like much from where you're standing, but it's mine, and I've been careful about it. He was quiet. That was one of his qualities. A patience that wasn't passive, that was actually the result of having thought about things and being willing to wait while other people caught up. What happened this morning, she said, in that room? I didn't do it because I was trying to be something. I did it because someone was dying and I knew what to do. That's all. I know. And now the whole hospital is going to spend the next week reconstructing who I am, and whatever I built here, the ordinary, unremarkable version of me that could just do her job, that's gone. He didn't argue with that because it was true. She appreciated that about him. He didn't argue with things because they were inconvenient. What do you need from me? She asked. A statement about what you observed with Voss. The sequence, the clinical reasoning, the intervention, documented and signed. He paused. And whatever you know about Hale, whatever you've seen, whatever you've documented over the past 2 years. She thought about the files she'd kept. The quiet, meticulous record she'd maintained not out of suspicion, but out of the same compulsion toward accuracy that had made her good at her job. Dates, discrepancies, the small decisions that added up to a pattern if you put them in order and looked at them without flinching. I have documentation, she said. Something moved in his expression. Of course you do. She didn't see Hale for the rest of that shift, which was notable because Hale was usually visible. He moved through the hospital with a proprietary ease, a man who owned the space he walked through. His absence from the floor had a texture to it. She felt it in the slight alertness of the other nurses, the way conversations paused when someone came around a corner, the particular charge in the air that happened when people knew something was coming but didn't know yet what shape it would take. She clocked out at 6 and stayed until 7, because there was a patient in room 8 with a potassium level that wasn't sitting right, and she wanted to make sure the evening nurse had the full picture before she handed off. This was normal for her. This was just what she did. She was walking to the parking structure when Martinez caught up to her. She heard his footsteps and slowed but didn't stop. He fell into step beside her. He was a good nurse. She'd always thought so, even when he was doing things she disagreed with, like following Hale's direction without asking enough questions. He was good at his hands and good at the hard conversations, and he'd been here 6 years to her too, which gave him a different kind of stake. What you did in there, he said. I've been trying to figure out if I should say something. You don't have to. I know I don't. I'm saying it anyway. He walked a few steps. I've been watching Hale do things for 6 years. I told myself there were explanations. I told myself I was reading it wrong. Another few steps. I don't think I was reading it wrong. She looked at him sideways. If someone asks me, he said, about specific incidents, the Tran case in February, the Rodriguez complication back in the spring, I want you to know I'll answer honestly. It was more than she'd expected from him, significantly more. Thank you, Ramon. He nodded once, split off toward the employee exit, and was gone. She stood in the parking structure for a moment before she found her car. The concrete was cold and the fluorescent lights buzzed in that specific frequency that always gave her a slight headache. She thought about the files on her laptop at home. She thought about Nathan Brooks and the particular weight of being seen by someone who'd known a version of you that you'd been trying to keep separate from your current life. She thought about Hale in his office, using his door-closed voice. She didn't know what he was arranging. She didn't know who he was talking to or what levers he was reaching for. But she knew him. Not personally, not as a friend or even an enemy, but professionally. The way you knew someone after 2 years of watching how they operated. She knew that he had not spent 15 years building his position at this hospital to watch it disassemble quietly. She knew that whatever was coming next, it was not going to be quiet. She got in her car and drove home and fed Rook, who met her at the door with the aggressive neediness of a cat who'd been alone too long and was not planning to be subtle about it. She sat on her couch with him on her lap and her laptop open and spent the next 2 hours going through her documentation files with the same methodical attention she brought to everything, organizing them, dating them, noting the connections she could see now that she hadn't been able to name before. It was close to 10 when her phone rang. Not a number she recognized. She answered it anyway. The voice on the other end was not Brooks. It was not anyone from the hospital. It was a man who identified himself in 3 short words that meant something specific and unambiguous in the particular world she'd thought she'd left behind. And what he said after those 3 words made her sit up straight on her couch and set Rook on the floor and reach for a pen, because some things you didn't trust to memory, no matter how good your memory was. He told her that Victor Hale had made 3 phone calls from his office that afternoon. He told her who Hale had called, and then he told her what Hale had said about her specifically, about Emily Carter, about what she'd done in that trauma suite, about what Hale believed she was capable of doing next. And the cold, deliberate nature of it was not something she'd been prepared for, even knowing what she knew. She wrote it down. All of it. Then she sat in her apartment in the dark for a long moment, Rook pressing against her ankle, the pen still in her hand, and understood that Victor Hale wasn't just protecting himself anymore. He was coming after her. She didn't sleep much. Rook settled on the pillow beside her head sometime around midnight, his weight a small, specific comfort, and she lay there with the ceiling above her and the notes she'd written face down on the nightstand and turned what the man on the phone had told her over and over in her mind, the way you turn something in your hands when you're trying to understand its shape in the dark. Hale had called 3 people. The first was his attorney, expected, rational, the move of a man who understood that legal protection was the first wall you built. The second was a board member named Paulson, one of the hospital's senior governance figures, who Hale had a history with that predated Redwood Crest, and apparently involved a shared investment structure that Emily had not known about, and that the voice on the phone had described with the flat, careful precision of someone reading from a document. The third call was to someone whose name she didn't recognize, a name that the voice on the phone said twice to make sure she'd written it correctly. Garrett Solis. Not a hospital figure. Not an attorney. The voice told her that Solis had a history of making personnel problems disappear for people who could afford his particular set of skills, and that the nature of Hale's conversation with him had been partly about Emily Carter's professional record, and partly, and this was the part that had made her reach for the pen, about her prior military service history, which Hale somehow had partial information about and was planning to use. She hadn't understood at first how Hale could have that. She'd been careful. Her record at Redwood Crest was entirely civilian. Her nursing credentials were clean and verifiable and entirely disconnected from anything that would point toward the 4 years before. She'd understood it by about 2 a.m, lying in the dark with Rook's breathing beside her. She'd made one mistake, or rather, she'd made one choice that wasn't a mistake, but had a consequence she hadn't fully tracked. 18 months ago, she'd submitted a case study to an emergency nursing journal, anonymized, cautious, technically about autonomic trauma patterns in high-stress environments. She'd been asked to include her clinical background as context. She'd listed advanced field trauma experience in a way that was vague enough to feel safe. It wasn't vague enough. Someone had connected it. Maybe Hale himself, maybe someone working for him. Either way, he knew enough to be dangerous, and dangerous in the specific way of someone who planned to take a truth and reshape it into something that looked like a liability. She got up at 5. She ran her 4 miles in the dark, the park nearly empty, the cottonwoods completely bare now, their branches making black lines against a sky that was just starting to separate from darkness into something gray and specific. She ran hard and didn't think about anything directly, which was a skill she'd learned in a different context and which still worked. Back in her apartment, she showered, made coffee she barely tasted, and called Brooks at 6:15. He picked up on the second ring, which told her he hadn't been sleeping much either. "I know about the calls," he said before she could start. "Then you know about Solis." "We flagged him 2 hours ago. He's done this before." It's a particular kind of character work, finding the angle on someone's past that can be reframed as a credibility issue. A pause. He's good at it. How much does Hale actually have? Enough to make noise, not enough to do real damage if we move faster than he does. Another pause, this one with more weight in it. Emily, the timeline I mentioned yesterday, it moved again. The task force is accelerating the hospital audit. They want to be on site by the end of the week. She processed that. What do they need from me before then? Everything you have. The documentation, the incident records, anything that gives the audit a baseline. He said the next part carefully. And they're going to need you to be visible. Visible. On the floor. In your role. Not hiding. Not preemptively requesting leave. If Hale is watching for signs that you're rattled enough to step back, we need him to see that you're not. She looked out her kitchen window. The sky had made up its mind to be gray and was committing to it fully. I know what you're asking, she said. I know you do. I'll be there. No. She walked into Redwood Crest at 6:58, 2 minutes before the start of her shift, the same time she walked in every day. She went to her locker, put her bag away, tied back her hair. Donna Reyes was at the charge desk with the morning handoff sheet and looked up when Emily appeared and gave her the particular kind of nod that communicated a complete sentence without using words. Specifically, I don't know exactly what's happening, but I see you and I'm paying attention. Emily nodded back. Same sentence, different direction. The floor was ordinary for the first 2 hours. 3 new admits overnight, 2 discharges pending, a patient in room 4 who'd pulled his IV line out and needed it replaced, and who was apologetic about it in the excessive way that people were when they'd done something embarrassing. She got through all of it the same way she got through everything, one thing at a time, in order, without allocating mental bandwidth to things that weren't in front of her yet. She didn't see Hale until 9. He came onto the floor from the elevator, not from his office, which was unusual. He generally moved through the hospital on a circuit that started from his office and radiated outward, maintaining a particular territorial logic. Coming from the elevator meant he'd been somewhere else in the building, somewhere higher up possibly. Administration was on the 4th floor. He saw her. She saw him see her. He didn't change pace or direction. He just looked at her for a moment with an expression that she read, with the practiced fluency of someone who'd spent 2 years tracking his moods, as a man who had decided something and was carrying the decision with him like a weight he'd chosen to pick up. He stopped at the nurse's station. He didn't look at her again. He picked up a chart, a physical chart, the kind he rarely used since the transition to electronic records, and made a notation on it with the specific deliberateness of a man performing normalcy. Good morning, he said to the station generally. Various people said it back. He left. Emily finished the IV replacement in room 4, documented it, and sent a message to Brooks through the secure channel they'd established the night before. He went to administration this morning. Watch for paperwork moving. The response came 12 minutes later. Already on it. Stay the course. But the first escalation came just after 11. She was in the medication room when Priya found her, slightly breathless, with the expression of someone who'd been trying to decide whether to say something and had finally made the call. There's a meeting in the boardroom, Priya said. 3rd floor. Hale is in there with Paulson and 2 people I don't recognize, and Donna just got called up. Emily set down the medication she was checking. How long ago? 10 minutes, and Priya hesitated. Your name came up. Not officially, but one of the admin assistants heard it through the door. Okay? Emily, they might be building a case to suspend you. I know. Priya stared at her. You know. I know it's possible. I'm not suspended yet. She picked the medication back up, finished her check, documented it. Tell me if Donna comes back. Priya left, not entirely satisfied with this response, which was a reasonable reaction. Emily spent the next hour and a half being the most visible, unambiguous, professionally irreproachable version of herself she was capable of being. She answered every call light. She preempted 2 medication questions before the patients had finished asking them. She sat with a woman in room 7 who was waiting on a biopsy result and who needed someone to be present with her in the specific way that was different from being busy present, which was the only kind of present most of the floor managed on a Tuesday morning. She sat with her and was actually there, which was a skill that looked simple from the outside and wasn't. Donna came back from the 3rd floor at 12:45. She found Emily at the nurse's station and said very quietly, "They're trying to flag your intervention yesterday as unauthorized practice." Emily had been expecting something in this direction. Grounds? The procedure you performed isn't in your listed competencies. Hale is arguing that you exceeded your scope and potentially endangered the patient. Donna's voice was controlled in the way that voices were controlled when the person speaking was carefully not saying what they actually thought. Paulson is sympathetic to his position. What did you tell them? I told them the patient's current vital status and prognosis were the most relevant available data points, and that I'd need to see a formal complaint in writing before I could respond to anything further. A pause. Paulson told me a formal complaint was being prepared. Emily looked at the desk surface for a moment, then she looked up. Donna, everything I've ever done on this floor. Have you seen me cut a corner? Have you seen me make a call I couldn't defend? Donna held her gaze. No. Then trust me for a little longer. Donna studied her with the particular assessment of a woman who had spent 22 years developing very accurate instincts about people. Whatever she found in Emily's expression seemed to satisfy something, because she nodded. Slow, deliberate, the nod of someone making a decision they intended to stand behind. Bum. The formal complaint arrived at 1:17, delivered to Emily via the charge desk in a sealed hospital envelope, which was an unusual method and which she recognized as a choice. Delivering it to her directly, publicly, on the floor, where colleagues would see it, was a move designed to produce a specific effect. She opened it without visible reaction, read it in approximately 90 seconds, folded it, and put it in her scrub pocket. Then she went to room 8 and checked on a patient with a persistent fever who was due for a reassessment. Her phone, on silent, vibrated with a message from Brooks at 1:34. Audit team moving up to Thursday. Hale's personnel action triggered our acceleration clause. Hold, she held. At 2:15, something happened that she hadn't predicted, which was unusual for her and which recalibrated her sense of how the next several hours were going to move. Marcus Voss's room, the private suite on the east corridor where he'd been moved after stabilization, where Park had been running the adjusted protocol with the continuous monitoring she'd specified. That door opened, and Marcus Voss came out of it. Not in a wheelchair. On his feet, moving slowly but under his own power, with the deliberate care of a man who'd been horizontal for 24 hours and was reclaiming verticality by an act of will. One of his security detail was with him. The other, she assumed, was still in the room. He was looking for her specifically. She could tell by the way his gaze moved down the corridor, methodical, patient, the scan of someone who knew what they were looking for and was prepared to find it. He found her outside room 9. "Mr. Voss," she said, "you should be in bed." "I've been in bed." He stopped about 6 feet away and looked at her with an expression that had none of the grandiosity of the man who'd walked into this hospital yesterday. He looked like a man who'd been to the edge of something and come back with a different set of priorities. "I heard what Hale is doing." "How?" "I have people who hear things." He said it simply, not as a boast. "He's filing against you." "I'm aware." "I want you to know that I'm prepared to provide a statement, a formal one, to whoever is conducting whatever investigation is actually happening here. And I'm not naive enough to think it's just a hospital audit." He looked at her steadily. "I know what you did yesterday. I know what you used. I've seen that procedure before, in a context that I understand you're not going to discuss in a hospital corridor. And I want to say on the record that what you performed was correct, appropriate, and the reason I'm standing here." She held his gaze for a moment. "You'll need to coordinate that with Commander Brooks." "Already done. He called me an hour ago." A slight shift in his expression, something that might have been a fraction of dry humor. "Apparently I'm a relevant witness." "Apparently." "Ms. Carter," he said it carefully, "I was wrong about you. I said that yesterday, and I'll say it to anyone who needs to hear it." He paused. What Hale is doing. It won't work. Not with me as a counterweight. She believed him. She also knew that the machine Hale had put in motion didn't necessarily require it to work completely. It just required it to cause enough disruption, enough delay, enough noise that he could create distance between himself and whatever the audit turned up. That was the play. Not victory, just interference. Go back to bed, she said. Your pressure needs to stay stable. He almost smiled. Yes, ma'am. He turned and went back into his room. She stood in the corridor for a moment and let herself feel, very briefly, something that wasn't quite gratitude but lived in the same neighborhood. Then she went back to work. The second major escalation hit at 4 in the afternoon, and it hit from a direction she hadn't fully prepared for. A woman arrived on the floor escorted by a hospital administrator, mid-level, someone she recognized but didn't know well, a man named Fitch, who handled HR compliance and who had never voluntarily come onto the nursing floor in Emily's memory. The woman with him was in her 40s, precise, with the careful posture of someone who spent a lot of time in rooms where language mattered. She introduced herself as Patricia Lorne from the hospital's legal department. They asked Emily for a meeting room. She said yes because the alternative was refusing in front of Donna and Priya and everyone else at the nurses' station, and she wasn't interested in performing distress. The three of them went into the small consultation room, not the same one where she'd talked to Brooks. The other one, the one with the crooked blinds that never quite closed fully. And Fitch placed a document on the table, and Patricia Lorne said, Ms. Carter, the hospital is initiating a temporary administrative suspension pending review of the complaint filed by Dr. Hale. This is standard procedure. Emily looked at the document. It was very clean, very official. The language was the kind of language designed to sound procedural and neutral while doing something specific. Effective when? She said. Effective today. End of shift. I'm in the middle of active patient care. The charge nurse will facilitate handoff. You'll remain on payroll during the review period, and you're entitled to respond to the complaint in writing within 48 hours, Emily said. I've read the policy. Patricia Lorne paused very briefly. Yes. Emily looked at the document for another moment. Then she looked at Fitch, who was not meeting her eyes, which told her something about how he felt about what he'd been asked to do. Then she looked at Lorne. I'd like a copy of the complaint as filed, she said. Not a summary, the full document with all supporting materials that Dr. Hale submitted. Yes, you're entitled to that. And I'd like it by close of business today. That may not be, it's a standard disclosure requirement under the hospital's own disciplinary policy, Section 4.3. I'd like it by close of business. She stood up. I'll finish my handoff. She walked out of the room without waiting for a response. In the hallway, she allowed herself exactly 4 steps of something that was not composure, a tightening in her throat, a specific heat behind her eyes that she was not going to allow to become anything visible. 4 steps. Then she put it somewhere internal and precise, the mental equivalent of a locked drawer, and went to find Donna. By 5 o'clock, the floor knew. This was inevitable. Floors always knew. The information moved through the social tissue of a hospital ward, the way infection moved through a compromised system, fast, and following the path of least resistance. She could see it in the way people looked at her, and then looked away, in the slight adjustment of spatial dynamics, in the fact that Priya had obviously been crying in the break room and came out red-eyed and defiant and stood next to Emily at the nurses' station for no particular clinical reason, just stood there, which was its own kind of statement. Donna handled the handoff with the quiet efficiency of a woman who was extremely angry and had decided that efficiency was the most useful available expression of that anger. Every patient transition was documented to a degree of thoroughness that was, in its own way, a small act of resistance. No one would be able to say anything had been missed. Emily stayed until 5:45, until the last transition was complete and documented. She said goodbye to 2 patients who'd been on her caseload long enough to notice she was leaving. She said it without drama or explanation. She was at her locker, changing out of her scrubs, when her phone buzzed with a message from a number she didn't have saved. Not a name, just a number. The message was 4 words, Check the third floor. She didn't know who'd sent it. She stood in the locker room with her bag in her hand and thought for approximately 8 seconds. Then she took the stairs. The third floor was administrative. Offices, the boardroom, conference space, the kind of carpeted, hushed territory that existed in a separate register from the fluorescent practical noise of the floors below. She came out of the stairwell and moved quietly down the hall past offices where people were winding down the end of a workday, gathering bags, shutting down monitors. She heard Hale's voice before she saw him. Coming from the boardroom, door not fully latched, the gap of maybe 2 inches, that was enough. He was talking to someone on speaker. She stopped in the hallway, back against the wall, far enough from the door that she wasn't visible. "The suspension is done," Hale was saying. "That buys us what we need. The audit team is coming Thursday." The other voice, from the speaker, was Garrett's Solis. She recognized the name's pattern in the way Hale referred to him, the slight formal edge. "Thursday is tight," Solis said. "It's tight, but it's enough. If the documentation she's been building looks like it came from someone with an axe to grind, someone with a history of operating outside sanctioned parameters, you have enough on the military angle? Enough to raise questions, enough to make her credibility the story instead of mine." A pause. "The board is with me. Paulson's locked in. If the audit team arrives and the primary whistleblower has a suspended credential and a flagged background, what about Voss?" A beat of silence. "Voss is a problem, but he's a sick man who had a traumatic medical event. His judgment is going to be questioned." Emily stood in the hallway with her bag at her feet and heard a man she had worked alongside for 2 years and 3 months lay out a plan to destroy her credibility, erase her record, and corrupt a federal audit. She heard him say it with the calm, organized fluency of someone who had done this kind of thing before. Not this exactly, but something in the same register. Her hands were steady. She was aware of this because she was always aware of them. She also became aware, after another 8 seconds, that she was not the only person in the hallway. Brooks was standing 12 feet to her left, against the wall on the same side. He had not been there a minute ago. He had the stillness of someone who had been in this kind of situation many times and understood that stillness was the most important available tool. He looked at her. She looked at him. He held up his phone. The recording app was running. The timer was at 4 minutes, 37 seconds, and climbing. She picked up her bag from the floor. There were voices at the end of the corridor. Not from Hale's room, from the elevator. 2 people, conversation, the sound of the elevator arriving. Ordinary end-of-day sounds. Brooks moved first, fluid and fast and quiet. The kind of movement that came from years of extracting from spaces without being seen. She followed, 2 steps behind, back to the stairwell, through the door that she held from swinging shut so it wouldn't make a sound. They stood in the stairwell. The recording was still running. Brooks stopped it. "How much of that did you hear?" he said, very quietly. "From the line about the suspension." He nodded. He was already texting with his other hand, thumb moving fast. "Task Force needs to know Hale is aware of the Thursday timeline. That changes our approach. He's going to try to move paperwork before the audit team arrives." "Yes." He glanced up. "Which means we move first." "What does that look like?" He put the phone in his pocket and looked at her with the expression she'd seen on him in the field once. Not before action, but at the point where a decision had already been made and what remained was execution. Clear, focused, slightly tired. "It looks like a very long night," he said. "And it looks like you need to call your union rep, your personal attorney if you have one, and anyone else who's been documenting their observations of Hale's conduct at this hospital." He paused. "Do you have a personal attorney?" "No?" "The task force will assign you one. As of right now, you are a protected federal witness, and Hale's ability to touch your credentials through the hospital's internal process just became significantly more complicated." He said it carefully, not triumphantly. "But Emily, this is going to get louder before it gets quieter. What he said on that call about using your background, he's going to file something. Maybe tonight, maybe tomorrow. It'll be public record when he does." She understood what he was saying, her history, the part she'd kept quiet, the part she'd filed away in a separate compartment. Those were about to stop being private. Not all of it. Not the classified pieces. But the broad fact of her, who she'd been, what she'd done, where she'd been doing it, that was about to become part of a record that other people could read. She'd spent 2 years building a life in which that wasn't true. "Okay," she said. "Okay." I said okay. She adjusted her bag on her shoulder. "What's first?" He looked at her for a moment with something she didn't analyze. Then, "I need you at the federal field office tonight, 7 o'clock. We're going to record your formal statement, document your files, and brief you on protective protocol." He handed her a card with an address. "And I need you to understand that after tonight, the shape of this changes. You won't be operating alone." She looked at the card. She thought about the apartment 12 minutes from here. She thought about Rook and the ordinary morning she'd had yesterday before all of this, the construction worker with the nail in his palm, and the teenager who cared more about lacrosse than his collarbone. She thought about the version of her life she'd built in the space between who she used to be and who she was now. She folded the card and put it in her pocket. She was halfway down the next flight of stairs when her phone buzzed. Not Brooks, not the task force, an internal hospital number, the kind that came from a specific office. She looked at it, the boardroom, 3rd floor. She stopped walking. The call went to voicemail. She waited, played it. Hale's voice, steady, professional, stripped of everything she'd heard through that 2-inch gap of door. "Ms. Carter, I understand you've been notified of the administrative action. I want you to know that this is not personal. I've always respected your work ethic. I hope we can resolve this professionally." A pause. "I've taken the liberty of providing some background on your prior service history to the relevant parties at this hospital. I felt transparency was appropriate." Another pause. "Get some rest." She stood on the stairwell landing with the voicemail still in her ear and understood that Victor Hale had just played his card. Not threatened her, tipped her. He wanted her to know he'd done it, wanted her to feel the shape of it, wanted whatever reaction that produced. She put her phone away. She thought about what he didn't know. He didn't know about the recording in Brooks's phone. He didn't know the audit team's timeline had already shifted. He didn't know about Martinez's statement, or Voss's formal cooperation, or the federal file that had been building for 4 months with its own weight and momentum that had nothing to do with her. He thought he was dismantling her. He was wrong about what he was actually dismantling. She went down the rest of the stairs and out through the hospital's side entrance into the October evening, the air sharp and cold off the mountains, the kind of cold that had a clarity to it. She walked to her car with the voicemail still sitting in her recent calls, and the card in her pocket, and the knowledge, quiet and absolute, that tomorrow was going to be a completely different kind of day. She was 3 steps from her car when she saw it. Her front driver's side tire was flat. Not low, flat, fully, the rim almost on the ground, a clean, deliberate flat with a mark on the sidewall that was not consistent with a road hazard. She stood and looked at it. Then she looked around the parking structure. Empty, quiet. The fluorescent lights buzzing their specific headache frequency. She took out her phone and called Brooks. When he picked up, she said, I'm going to need a ride to the federal field office." He asked why. She told him. A silence. Then, with a careful quality that she recognized as the sound of someone shifting from one level of concern to a higher one, "Don't move. I'm sending someone now." She stood by her car in the cold parking structure and waited. And the only thing she could hear was the buzz of the lights and the distant mountain wind, and she understood, standing there, that Victor Hale had just made a significant miscalculation. He'd tried to rattle her. He had no idea what she was made of. The person Brooks sent was the woman from his team, the one who'd stood at the monitoring equipment in Voss's suite, whose name Emily still didn't know. She arrived in 11 minutes in an unmarked gray sedan, no introductions beyond a nod, and Commander Brooks asked me to drive you. And that was fine. Emily had spent 4 years working alongside people whose names she didn't know, or knew only in the way that mattered in the field, which was differently from how names usually mattered. They drove without conversation. Emily watched the city move past the window. The particular Denver evening, the mountains gone dark against a sky that was still faintly orange at the horizon, the streets doing what streets did at 6:30 on a Wednesday, which was carry people home from things and toward other things. The ordinary hydraulics of a city that didn't know and didn't need to know that one of its hospitals was currently the center of something that was going to make a certain kind of news. She thought about Hale standing in his office making phone calls. She thought about the tire and the deliberateness of it, the mark on the sidewall, the specific placement. Not random. A message. The kind of message that was designed to live in the space between threat and plausible deniability, where a lot of the worst things lived. She thought about the voicemail. Get some rest. The particular menace of civility deployed as a weapon. The federal field office was in a building that looked like it had been designed specifically to look like nothing in particular. Beige, mid-rise, the architectural equivalent of a cleared throat. Inside it was the kind of clean that came from institutional funding and the absence of organic life. She was brought to a conference room on the 3rd floor, where Brooks was already waiting with 2 people she hadn't met. A woman in her 50s named Diane Achterberg, who was the task force lead, and a younger man named Salas, who turned out to be her assigned legal counsel, and who had the precise, attentive manner of someone who'd been very good at a demanding school and had not since lost the habits it installed. They went for 3 hours. It was not comfortable. Achterberg was thorough in the way that federal investigators were thorough, which was comprehensively and without regard for the emotional texture of the information she was extracting. She asked Emily about every documented discrepancy she'd flagged at Redwood Crest. She asked about specific patients by case number, specific dates, specific medication decisions. She asked about the Rodriguez complication in the spring and the Tran case in February, and 4 other cases Emily had documented, and 2 she hadn't specifically flagged but had noted in her own records as anomalous. She asked about Kandahar. Emily answered that one carefully, with Salas beside her noting what was relevant to the hospital matter and what was outside the scope. Some of it was still classified at a level that didn't belong in this room. The rest of it, the training, the field experience, the specific medical knowledge that had informed what she'd done in Voss's trauma suite, that was relevant, and she laid it out with the same precision she brought to everything, not dramatizing, just accurate. Achterberg listened without expression. She was good at her job in the specific way of someone who'd learned to separate being affected by something from showing it. At the end, she closed her notebook, a physical one, actual paper, Emily noted, which was a choice people in certain fields made deliberately, and said, "The complaint Hale filed this afternoon references your military background as evidence of a pattern of unauthorized unilateral action." "I know. He's framing your intervention with Voss as consistent with a documented tendency to exceed scope. That's a creative interpretation of what happened. It's what he filed. We'll be countering it with Voss's statement, the clinical outcome data, and the recording from the corridor." Achterberg paused. "But I want you to understand something. When this goes public, and it will go public, probably within 48 hours of the audit team entering that hospital, your background is going to be part of the story. Not the classified elements, but the fact of your service, the field medicine experience, the gap between what your nursing resume showed and what you actually were." Emily looked at the table for a moment. "I know. Are you prepared for that?" She thought about the locker room at Redwood Crest, the ordinary dimensions of the life she'd built there, the 4-mile run in the morning, Rook on the pillow, the patient in room 7 waiting for her biopsy result, who'd needed someone to just be present with her. "Yes," she said. Achterberg nodded once. "Then we're prepared to move." She got home at 10:15. Rook was incandescent with grievance. She fed him, changed into clothes that weren't the ones she'd put on that morning, which felt like a week ago, and sat on the floor of her living room with her back against the couch, because sometimes the floor was the right altitude for how things felt. Rook eventually climbed into her lap and permitted himself to be held with the graciousness of a cat who'd decided that forgiveness served his interests. She didn't sleep much again. This was becoming a pattern. Thursday arrived with a cold front that dropped 6 inches of snow on Denver overnight, the first real snow of the season, which had the effect of making everything slightly unreal. The city muffled in white and temporarily soft, the usual edges of things smoothed over. Emily was up at 5. She ran her 4 miles. The park was empty and the snow was still falling, slow and specific, and her footprints were the first in it, which felt like something she didn't need to assign meaning to, but noticed anyway. She arrived at Redwood Crest at 7:45, which was earlier than her shift would have started if she'd still been on her regular schedule. She wasn't reporting for a shift. She was reporting because Achterberg had told her to be there before 9, and because there was something in her that needed to be present for what was about to happen, even though nothing about her situation required her personal presence in the building at this hour. The audit team arrived at 8:12. She saw them from the main lobby. 6 people, not in uniforms, but with the collective bearing and the specific quality of luggage that federal auditors carried, the kind of bags that held equipment for documentation, the kind of purposeful, bureaucratically armed group that when it entered a building changed the atmosphere of the building in a way that was specific and unmistakable. Achterberg was with them. She saw Emily in the lobby, registered her with a nod, and kept moving toward administration. The hospital's response was visible in real time. The word moved from the front desk to the administrative floor in under 4 minutes. She could track it by watching the way people moved, the way conversations altered, the way Donna Reyes appeared at the end of the lobby hall with an expression that said she had understood something and was deciding what to do with that understanding. Emily walked to the nurse's station. "You're suspended," Donna said, in the tone of a woman who was technically stating a fact and also clearly asking a question. "I'm here as a federal witness," Emily said. "I'm not on the floor clinically. I just needed to be here." Donna looked at her for a long, assessing moment. Then she stepped back and made room at the station, which was its own kind of answer. Ticked. Hale arrived on the floor at 8:47. He had not, she could see immediately, expected her to be there. The calculation on his face when he came around the corner and found her standing at the nurse's station was fast and telling. Surprise, then rapid reassessment, then the practiced smoothing of a man who was good at recovering his expression. He covered it in under 2 seconds. But she'd been watching him for 2 years and 3 months, and she'd had better than 2 seconds. He looked from her to the audit team, which was now visible through the glass of the administrative wing, moving with the deliberate efficiency of people who knew exactly what they were looking for and where to find it. He looked at the 2 people from Brooks's team who were stationed, not conspicuously, but specifically, at either end of the corridor. He looked back at Emily. "Ms. Carter," he said, "you're aware that your access privileges have been—" "I'm here in a federal witness capacity," she said. "You're welcome to verify that with the task force lead who's currently in your administrative wing." A silence. Something moved behind his eyes that she read as recalculation. He was reassessing how far along this was, how much he didn't know. "This is an overreach," he said, and his voice was controlled, but she could hear the edges of something underneath it now. "Whatever you've told, whatever you think you've documented, this is a hospital matter, internal. The federal involvement here is—" "Dr. Hale," Achterberg's voice from behind him. He turned. She was standing 10 feet away with 2 members of her team and the particular expression of someone who has said a person's name, not because they want conversation, but because they want the person to stop moving. "I need you to come with me, please," Achterberg said. He went. Not willingly. She could see the stiffness in his shoulders, the way he walked like a man maintaining posture by effort. But he went, because there was nothing else available to him in that corridor at that moment, and whatever else he was, he understood when a situation had shifted past the point of performance. Emily watched him go. Donna beside her exhaled quietly. "Holy," she said softly, and left the rest of the sentence to context. Eat. The audit took most of the day. Emily gave 2 additional statements, once in the morning to a federal medical investigator who specialized in clinical misconduct, once in the afternoon to someone from the DOD side of the task force who was specifically interested in the Voss case and the events of Tuesday. Both times she was precise, sequential, unemotional in the way that was not the absence of emotion, but the management of it, which was the only way she knew how to do difficult things. Between statements, she sat in a small office that Achterberg had commandeered, with Salas going through documents, and watched through the window as the hospital tried to maintain the ordinary business of a clinical day, while also processing the fact that its most senior trauma surgeon was in an administrative meeting with federal investigators and had been there for 4 hours. Martinez came and found her at noon. He knocked on the office door, which was glass, so the knock was mostly ceremonial. She'd seen him coming down the corridor, and when she opened it, he handed her a sealed envelope without explanation. "From Park," he said. She opened it after he left. Inside was a single page, a clinical summary of Marcus Voss's current condition and trajectory, and at the bottom, in Park's handwriting, not typed, handwritten, a paragraph that she read twice. It said that he had reviewed the intervention she'd performed on Tuesday and had subsequently spent 2 evenings going through the field medicine literature she'd referenced in her statement, and that he believed her assessment had been correct, and that his own initial treatment approach had been moving in a direction that would have significantly worsened the patient's condition. He said this without hedging and without the defensive qualifications that physicians typically installed around admissions of error. He said that he wanted it documented. She folded the page and held it for a moment. Then she put it in the file that Solace was maintaining, because it was evidence and it belonged there, and also because somewhere in her chest there was a quality of relief that had nothing to do with strategy, and that she was not going to examine too closely right now. The first public break came at 3:40 in the afternoon. Achterberg called a brief in the commandeered office, pulling in Brooks and the 2 senior members of her audit team. Emily was included because she was a witness, and because, at this point, the pretense of keeping information siloed was less useful than making sure the people who needed to understand the full picture actually understood it. "We have the financial trail," Achterberg said. She set a laptop on the table with a document pulled up. A summary, not the raw data, but enough. Hale has been receiving payments from a procurement consulting firm called Meridian Strategic, which is a shell with Garrett Solis as its listed principal. The payments began 22 months ago. Cross-referencing with patient outcome records from the same period, we have 9 cases where Hale's clinical decisions altered the standard of care in ways that created liability exposure for Redwood Crest, which then required the hospital to engage outside legal services, one specific outside legal firm, for settlement negotiations. Emily looked at the document. He was manufacturing liability and directing the resolution of that liability through channels where Meridian had a financial interest. Achterberg's voice was flat, which was what her voice was when the thing she was describing was particularly bad. Marcus Voss was the 10th case. His admission to Redwood Crest was not random. Voss has been in dispute with a DoD contractor that has a consulting relationship with Meridian. His health management was being directed. The room was quiet in the way that rooms were quiet when the thing being said was worse than what people had been expecting. Brooks said, very carefully, "You're saying Hale was managing Voss's clinical care to serve an external financial interest." "We're saying the evidence is consistent with that conclusion. The district attorney's office will characterize it more specifically." Achterberg closed the laptop. "Hale's attorney has been notified. We expect a formal legal response by end of day." Emily thought about Tuesday morning, the way Hale had positioned himself in her path in the corridor, the specific words he'd used. Stay in your place. The practiced smoothness of a man who had spent nearly 2 years managing a situation that she had stumbled into without knowing it was a situation, and who had been good enough at managing it that it had nearly cost a man his life. She thought about Mrs. Delacroix and the medication that should have caused a reaction. She thought about Rodriguez and Tran and the other names in the audit file. The patients who had moved through Hale's care and whose courses had been subtly, deniably, professionally shaped by a man who had told himself whatever story a person had to tell themselves to do that. She kept her face where it was. "What about Paulson?" she asked. "Board member Gerard Paulson is being separately interviewed this afternoon. His financial relationship with Meridian is more indirect, but it's there." Achterberg looked at her. "He was the one who approved Hale's personnel action against you. The timing is being examined." "Is the suspension still active?" "Legally, yes. Practically," Achterberg almost did something with her mouth that was not quite a smile. "The hospital's CEO has been made aware of the full scope of this investigation as of 1 hour ago. I expect you'll be hearing from them directly before tonight." She heard from them at 5:20, not from the CEO directly, through the hospital's legal counsel, A different person from Patricia Lorne, who delivered the suspension letter. Someone more senior, who spoke with the careful, stripped-down language of an institution that had just understood its own exposure and was making adjustments accordingly. The administrative suspension was rescinded, pending formal review completion. Her access and credentials were reinstated. The hospital would be in touch about the formal resolution process. She received this information sitting in the small office with Salas beside her and the snow still falling outside, heavier now, the mountains completely gone behind it. "That's good," Salas said. "It's a start," she said. Hale was placed on administrative leave at 4:55, the announcement delivered internally, and then, at 6:30, externally. A hospital statement that said very little in the specific way that hospital statements about ongoing legal matters said very little, but which said enough that the local news had 2 reporters at the Redwood Crest main entrance by 7. Emily was not there to see the reporters arrive. She'd left the building at 6, driven by Brooks to a hotel 2 miles from the hospital that the task force was using as a secondary base, because the question of whether last night's tire had been a standalone message or the opening of something more extended was still open, and her apartment was not, for the moment, where Ochterberg wanted her. She sat in a hotel room that was aggressively beige and called her sister in Flagstaff, who didn't know any of this and who picked up with the cheerful lack of context of someone existing in a completely different reality. And Emily talked to her for 20 minutes about nothing in particular. Her sister's kids, a renovation project, a neighbor's situation that had been ongoing since summer, and let the sound of a familiar voice be what it was, which was a reminder that the world was mostly made of ordinary things, and that ordinary things were real even when you were temporarily living at a different altitude. After she hung up, she sat on the edge of the hotel bed and let herself be tired. Not dramatically, just present with the fact of how much had happened in how short a time and how little sleep she'd had, and how the particular adrenaline economy of the last 48 hours had costs that didn't present the bill until you stopped moving. She ate half a room service sandwich, fed Rook remotely through the automatic feeder in her apartment, and fell asleep at 9:15 without meaning to. Friday moved differently. She was at the field office by 7:30. The audit team had worked through the night. She could see it in the particular texture of the room, the coffee cups, the slightly processed quality of attention that people had after they'd been awake too long and were running on something other than rest. Ochterberg looked the same as she always looked, which was either a natural condition or a skill. The DA's office had been in contact since early morning. Salas briefed Emily on the shape of it. The evidence Ochterberg's team had assembled was sufficient for formal charges on multiple counts, including insurance fraud, clinical misconduct with intent, and conspiracy. The federal elements, the Voss connection, the defense contractor angle, Meridian's reach into government procurement, would be handled federally in parallel. "He's not going to fight it," Salas said. His attorney made contact this morning about a cooperation discussion. "He's going to try to deal." "He's going to try. Whether they take it depends on what he offers." Salas looked at her over the document he was holding. "Your documentation was significant. The 9-case pattern we identified. Half of it came from your records." She absorbed that. "You'd been keeping those files for how long?" he asked. "About 14 months. Just routinely. I noticed things that didn't add up. I wrote them down." She looked at the wall. "I thought I was wrong. I kept hoping I was wrong." Salas was quiet for a moment. "You weren't wrong. I know." Voss. The hospital board held an emergency session on Friday afternoon. Emily wasn't in it, but Brooks was, as was Ochterberg's deputy. What came out of it, communicated to Emily through Salas at 4:15, was that the board had voted to remove Gerard Paulson from his governance position, that a full external review of Redwood Crest's clinical governance structure had been commissioned, and that the board's chair had spoken directly with the hospital CEO about the circumstances of Emily's suspension. The CEO called her at 4:45. His name was Daniel Ferris, and she'd met him twice in 2 years, once at a hospital-wide staff meeting, once briefly in a corridor. He was in his early 60s, had the measured effect of someone who'd spent decades in healthcare administration. And when he spoke to her, he did not lead with the suspension or the reinstatement or the public relations geometry of the situation. He led with, "I owe you an apology." She waited. "I've been made aware of the specific documentation, what you flagged, how many times, through what channels. And I have to tell you that the appropriate response to that documentation should have been a conversation with you, not silence." He paused. "The system failed to protect you, and I was responsible for that system." She thought about what to say. She thought about the various things she could say, the range from gracious to honest, and settled on something that was both. "I appreciate that," she said, "and I want you to know that what I did, the documentation, the flags, I wasn't trying to build a case. I was trying to do my job accurately." "I know that." Another pause. "I'd like to discuss, when things have settled, what your role at Redwood Crest looks like going forward. I think we have things to address." "Yes," she said. "I think we do." She hung up and stood in the hallway of the field office and thought about the conversation she'd just had, and about all the conversations that had led to this one, and about the long, patient accumulation of small, honest actions that had been, in the end, the thing that mattered. Saturday morning, Garrett Solis was arrested at his home in Boulder. The arrest was not dramatic in the way that public arrests sometimes were. No news cameras in time to catch it. The timing was deliberate, early, chosen specifically for the absence of audience. Achterberg told her about it in a text at 7:42, which was 4 minutes after Emily had finished her run and was standing in the parking lot of the hotel with her hands on her knees, catching her breath. Solis, the man whose name had come to her through a phone call in the dark. The man who made personnel problems disappear. Arrested, charged, in custody. She stood in the cold morning air for a moment. Then she went inside. By mid-morning, Victor Hale's cooperation discussion had apparently not reached a satisfactory conclusion because word came from Salas that Hale's attorney had withdrawn the cooperation offer and Hale had been formally charged. The charges were filed publicly, which meant they were now on a court docket, which meant they were now real in the specific way that things became real when they existed in a public record. She saw it on her phone, the news alert, the headline, the hospital's name and Hale's name in the same sentence. She read it once. Then she put her phone face down on the hotel room desk and sat quietly for a few minutes. She wasn't glad, exactly, or she was glad in the way that was really just relief that something true had been confirmed, which was its own thing and felt different from satisfaction. Satisfaction implied that something had been won. This felt more like something had been corrected. It was almost the same, but not quite. Marcus Voss was discharged from Redwood Crest on Saturday afternoon, medically cleared under the revised treatment protocol, with a follow-up plan that had been co-developed by Park and the DoD medical liaison that Brooks's team had arranged. He walked out of the hospital on his own 2 feet, slower than he'd have liked, supported less than his security team would have preferred. He'd asked to see Emily before he left. She went to the suite. He was dressed, sitting in the chair rather than the bed, which was a choice that meant something. His color was fully back. He looked like a man who'd been shaken hard and had reorganized. "I made some calls this week," he said when she came in. "I heard." "I wanted you to know that the statement I gave the task force was complete. Everything I could give them, I gave them." "I know, thank you." He looked at her for a moment. "I said I was wrong about you. I meant it, but I want to say something else, too." He was choosing his words. "You didn't have to come back into that room Tuesday. I told them to remove you. Whatever was happening with Hale, whatever the politics were, you didn't know any of that when you came through that door. You came back because someone was dying and you knew what to do." "Yes. That's a specific kind of person," he said. "I've known enough of them to recognize it." She looked at him. He was not wrong, and there wasn't much to say to it, and so she just received it. "Take care of yourself," she said, attempting to. She left him there and walked back down the corridor toward the elevator, and she was almost to the nurse's station when Donna appeared from around the corner with the particular expression of someone who had been waiting with news and had run out of patience for waiting. "The board liaison called," Donna said, without preamble. "They want to schedule a meeting with you next week. About the emergency department. Emily looked at her. The emergency department. They're talking about a structural review of the trauma training program, the clinical protocols, the supervision structure. Donna paused. They mentioned your name in the context of being involved in shaping what comes next. Emily was quiet for a moment. Also, Donna added, Priya has been telling everyone on the floor about what happened in that trauma suite, in a level of detail that I have not attempted to verify or curb. Of course she has. And Martinez put something in writing, an unsolicited incident report going back 18 months, voluntary, his name on it. Donna held her gaze. There are people in this building who've been watching what Hale was doing for a long time, and they've been quiet about it, and they're not quiet about it anymore. Emily thought about that, the specific weight of it, the way that sometimes what changed things wasn't the loudest action, but the accumulation of smaller ones, the person who kept a file for 14 months, the nurse who stood at a station for no clinical reason, the doctor who wrote a paragraph in his own handwriting. She thought about the patient in room 7, waiting for a biopsy result. She thought about the construction worker and the teenager and Mrs. Delacroix and all the ordinary human business of being the person in the room when something went wrong and someone needed help. I'll take the meeting, she said. Yes, Sunday was quiet in the way that Sundays sometimes were. Not peaceful, exactly, more like the absence of the immediate pressure of events, which was its own unfamiliar texture after the last 4 days. She went back to her apartment. Rook expressed displeasure about her absence at a volume that suggested he'd been planning his objections and had simply been waiting for her return to deliver them. She made actual food for the first time in what felt like a week, something with eggs and vegetables that wasn't particularly good, but was warm, and hers. She was on her couch at 7 in the evening with Rook on her lap and her documentation files open on the laptop, going through them not because she needed to add anything, but because she'd maintained them for 14 months, and the habit of looking at them had become its own kind of anchor when her phone rang. Brooks. She answered it. How are you? He said. Not procedural, actually asking. I'm okay. She meant it more or less. Tired, but okay. The formal charges for Hale go to the DA's office Monday morning. The federal counts will be filed by end of next week. Achterberg says the timeline on resolution is 6 to 12 months through the court process, but his ability to practice medicine is effectively over, regardless of how it resolves legally. I know. Paulson's separate. That'll take longer. I know. She looked at Rook, who had fallen asleep with one paw on her forearm. Nathan. Yeah. The board wants to meet next week. About the emergency department. A pause. Donna told me. You've been talking to Donna? She called me Thursday to make sure you were safe. She's very direct, your charge nurse. Emily almost laughed. Almost. What do you think I should do? He was quiet for a moment, and she knew he was taking the question seriously, which was one of the things about him that had been true in the field and was apparently still true in a hotel parking lot in Denver. I think you've spent 2 years making yourself small, he said, and I think you're good at it, but I also think it cost you something, and I think the version of you that walked into that trauma suite on Tuesday doesn't belong in the margins. She sat with that. Okay, she said. Okay? I said okay. She looked at the laptop, at the 14 months of careful, quiet, methodical documentation. I'll take the meeting. After she hung up, she stayed where she was for a while, in the ordinary quiet of her apartment, Rook breathing on her arm, the city doing whatever it did outside her window on a Sunday evening. She thought about Tuesday morning, the construction worker, the teenager, Mrs. Delacroix, the ordinary texture of a morning that had turned into something else. She thought about the moment she'd pushed through the trauma suite door, not the version of the moment she'd thought about afterward, examining it for doubt or justification, but the actual moment. The monitor visible through the glass, the pattern she'd recognized, the specific clarity of knowing what to do when someone's life was in the hands of people who didn't know what they were doing. She had not hesitated. She never hesitated when the thing in front of her was clear. That had always been true. She closed the laptop, She was about to get up to refill her water when her phone buzzed with a message from Salas. She read it again. Salas had received a communication from Hale's attorney in the last hour. Not the cooperation discussion that had collapsed on Saturday, but something new. A separate piece of information that Hale was apparently offering, not as part of a deal, but as what his attorney was calling a voluntary disclosure. The disclosure was about a patient from 11 months ago, a case not on Emily's radar, not in her documentation files, a case that had been quietly closed through a legal settlement before she'd had any reason to look at it. A case involving a 26-year-old woman named Avery Drummond who had been treated in the Redwood Crest Emergency Department after a workplace accident and whose post-surgical course had been, according to Hale's voluntary disclosure, deliberately mismanaged under his direction. Avery Drummond, according to the disclosure, had died. Emily set her phone down on the couch cushion beside her. The room was quiet. Rook shifted in his sleep. She looked at the phone for a long moment. Then she picked it up and called Salas back, and when he answered, she said very steadily, "Tell me everything." Salas talked for 22 minutes. Emily listened without interrupting. She sat on her couch with Rook still asleep against her leg, and the Sunday evening city noise coming through her window, and she let Salas lay out the shape of it, the dates, the case number, the sequence of events as Hale's attorney had described them in the voluntary disclosure. She let it land the way difficult information needed to land, which was fully, without cushioning. Avery Drummond had been 26 years old. She'd worked in a warehouse distribution facility on the west side of Denver and had been brought to Redwood Crest after a forklift accident that had caused internal trauma to the chest and upper abdomen. She'd had surgery, which had gone well. Her post-surgical course, according to the disclosure, had not gone well because Hale had made specific clinical decisions in her aftercare, decisions that had been documented as medically indicated, but that the disclosure now described as deliberately substandard. The settlement had gone to her family 6 weeks after her death. The amount was sealed. The cause of death on the official record was listed as post-operative complications, which was technically accurate in the way that a lot of terrible things were technically accurate. Hale's attorney framed the disclosure as voluntary. Emily understood what it was, which was currency, information offered by a man who had calculated that its controlled release served him better than its eventual discovery through the audit process, which was coming and which would have found it. It was not conscience. It was strategy wearing the clothes of conscience. "What does this do to the charges?" she asked when Salas finished. "It adds to them, significantly." He sounded tired in a way he hadn't sounded all week. "The DA's office is treating it as a potential involuntary manslaughter count, possibly more depending on what the full record shows. The federal side is reevaluating whether the Drummond case connects to the Meridian financial trail." "Does it?" "Too early to say." She looked at the wall across from her. There was a photograph on it. A landscape, mountains, something she'd bought at a street market in Tucson 3 years ago because the colors were right. She'd looked at it 1,000 times without thinking about it. She was looking at it now without seeing it. "Her family," she said, "the family has been contacted by the DA's office. Did they know? That it wasn't just complications?" "No. The settlement included a non-disclosure agreement. They signed it because they didn't have a reason not to." She sat with that for a moment. A 26-year-old woman and a family who'd been told one thing about how she died and had spent 11 months living inside that version of the story, which was not the true version and had never had the chance to know the difference. "Okay," she said. "Thank you, Salas." She hung up and stayed very still on the couch for a while. Rook woke up, stretched, looked at her with the frank assessment of a cat determining whether the current emotional atmosphere required action on his part, and then put his chin on her knee and stayed there, which was its own answer. She wasn't going to be able to sleep. She accepted that and stopped trying. She opened her laptop and started writing, not a formal document that could wait for morning, but notes, the kind she'd always kept, sequenced, dated, honest. She wrote down everything Salas had told her about Avery Drummond. She wrote it with the care she brought to things that mattered, which was the only speed she had for anything. She wrote until 2 a.m, and then she stopped, and then she closed the laptop and sat in the dark of her apartment and thought about a woman she'd never met who had died in a hospital where Emily had been working and hadn't known, hadn't seen it, had been close enough that it should have been visible and wasn't. She didn't punish herself for that. It wouldn't have been accurate. She'd documented what she could see. Hale had made sure the Drummond case wasn't something she could see, but she sat with the weight of it anyway, because sitting with the weight of something true was not the same as guilt. It was just the thing you did when you were paying attention. Monday arrived gray and determined. She was at the federal field office at 7. Achterberg was already there, which was not surprising, and looked like she'd had approximately as much sleep as Emily, which was its own form of solidarity. They went through the Drummond disclosure for an hour and a half with 2 people from the DA's office joining by video, a prosecutor named Holt, who was methodical and specific and asked questions that showed she'd already been through the available record twice before this call, and her colleague, who handled the forensic accounting side and kept surfacing connections between the clinical timeline and the meridian payment dates. The connection was there. Emily could see it being assembled in real time across the table, the way a picture emerged when you had enough pieces and the right angle of light. Hale had received a payment from Meridian 3 days before Avery Drummond's post-operative plan was altered. Another payment 11 days after her death, the same week the family received the settlement offer. Holt said, "We're amending the charges." No one in the room said anything for a moment. "The manslaughter count," Achterberg said, "plus fraud in the settlement process." "Yes." Holt's voice was even. "And we're adding a co-conspirator review for Solis given the payment timing." Emily looked at the documentation spread across the table. 14 months of her notes, Park's handwritten paragraph, Martinez's incident reports, Voss's formal statement, the recording from the third-floor corridor, a financial trail that had been building in a federal file for 4 months before she'd ever known any of it existed. It was a picture now. It was whole. She thought about how long it had taken to become whole. She thought about all the points at which it could have stayed partial. If she'd stopped documenting after the first time Donna seemed uninterested, if she'd accepted Hale's professional framing of her as a problem rather than a person with accurate observations, if she'd left Redwood Crest after year 1 when the weight of being consistently underestimated had been specific and daily and exhausting. She was glad she hadn't left. The formal board meeting happened Tuesday afternoon. It was not what she'd expected, which was a cautious institutional conversation full of procedural language and careful hedging. It was more direct than that, maybe because the events of the past week had burned through the usual buffer of corporate caution and left people talking more plainly than they would have otherwise. There were 6 people in the boardroom: the CEO, Daniel Ferris, 2 board members who'd replaced Paulson in the relevant committee structure, the hospital's chief nursing officer, a woman named Roberta Waits, whom Emily had met twice and whose opinion of Emily had always been opaque, the head of the emergency department, Dr. Soren, older, careful, a man who'd been watching the Hale situation with the expression of someone who'd had suspicions for longer than he'd been willing to say out loud, and Emily herself. Ferris opened it without preamble. "We want to talk about what this hospital needs going forward and where you fit in that picture." Emily looked at him. "Okay." The emergency department's trauma training program hasn't been substantially updated in 6 years. Our protocols for high-acuity autonomic events are, we've been told by the task force medical consultants, substandard compared to what's available and what's been learned in field medicine settings over the past decade. He paused. "You have knowledge we don't have. You have a teaching background. Your service record, which we've now been briefed on in the appropriate way, includes formal instruction of field medics." "It does. We want to build something, a revised trauma training program, new protocol framework for complex presentations, something that makes this emergency department better than it was." He looked at her steadily. "We want you to lead it." She'd known this was coming, or had thought it was coming, but hearing it said clearly in a room with 6 people and afternoon light coming through the windows, and the snow from last week still visible on the mountains behind the glass, hearing it said as a real thing rather than a hypothetical was different from thinking it might happen. Waits spoke. She had a direct, measured way of talking that Emily had always appreciated from a distance. "I want to be honest with you. Some of what we're proposing goes against how we typically think about role structure here. You're a staff nurse. What we're describing is more than that." "I know," Emily said. "We'd be creating something new. It would need to be built carefully, with the right credentialing structure, the right reporting lines." Waits looked at her. Are you interested in building something that doesn't have a template? Emily thought about that for a moment. Not long. She'd been thinking about it in the back of everything since Donna had mentioned it on Saturday. But she took the moment anyway because it deserved a moment. Yes, she said. I am. Soren leaned forward. He'd been quiet until now. I want to say something, if that's all right. He looked at Emily with the expression of a man choosing his words with unusual care. I've been in emergency medicine for 27 years. I've worked with a lot of people, and He stopped, tried again. I saw things over the past 2 years that I categorized incorrectly. I told myself there were explanations. I'm not going to dress that up. He held her gaze. I'm sorry for that. And I think what you did, not just Tuesday, but every day for 2 years when it would have been easier to stop doing it, that's the kind of thing this department needs more of. The room was quiet. Emily had rehearsed, somewhere in the back of her mind, various versions of how a moment like this might feel. She'd imagined vindication as something sharp and clean, the satisfying completion of an equation. It wasn't like that. It was more complicated and more human than that. There was something in her chest that was relief and something that was sadness, and something that was just the plain, uncomplicated weight of being seen accurately after a long time of being seen wrong. Thank you, she said. She meant it plainly. So, Ferris said, do we have a conversation to continue? We have a conversation to continue, Emily said. The charges against Victor Hale were made fully public on Wednesday morning. She read the news report on her phone sitting at the nurse's station. Not because she was back on a full clinical schedule yet. There were another few days of administrative process still working through, but because she'd come in early and Donna had made coffee, and the station was where she naturally landed when she was in the building. The report was thorough. The fraud charges, the misconduct counts, the amended manslaughter charge related to Avery Drummond. Garrett Solis was named as a co-conspirator. The Meridian Shell Company was described in enough detail that the financial structure of it was legible. Paulson was referenced in connection with the board governance failures. The report also referenced a nurse. It didn't name her. Ochterberg had made sure of that for now, citing the ongoing federal witness protocols, but it described, in a paragraph near the end, a staff nurse at Redwood Crest who had maintained documentation of clinical irregularities for over a year and whose intervention in a VIP patient's medical crisis had triggered the events leading to the investigation. Donna read the same paragraph over her shoulder and said, very quietly, "There she is." Emily looked at the screen for another moment. Then she put her phone down. There were patients on the floor, there was work to do. There were always patients, and there was always work. And that was, when everything else stripped away, the thing that had been true every single day she'd walked into this building. Before the suspension, before the federal investigation, before Tuesday morning, and everything it had set in motion. The work had been real the whole time, even when everything around it was compromised, and that was something. She met Avery Drummond's mother on a Thursday afternoon, 3 weeks after the charges were filed. It was not a meeting that had been arranged through official channels. Waits had told her, carefully, that as a witness in an ongoing prosecution, she should be thoughtful about contact with related parties. Emily had spoken to Salas, who had spoken to Holt, who had determined that a voluntary, non-facilitated meeting was not prohibited and was, in Holt's words, not her business. Avery's mother's name was Carol. She was 54 and had driven from Colorado Springs, and she sat across from Emily in a coffee shop 2 blocks from the hospital with the particular stillness of a person who had done a great deal of grieving and had come out the other side into something that wasn't peace, but was perhaps its nearest available neighbor. They sat with their coffee for a moment before either of them said anything. "I don't know what I wanted to get from this," Carol said finally. She had Avery's picture on her phone and had shown it to Emily, a young woman with a direct gaze and a laugh visible in her eyes, even when she wasn't laughing. "I've been angry for 3 weeks since the DA called us. I keep trying to figure out where to put it." "I know," Emily said. "You didn't know her." "No. But you knew something was wrong before any of this." Emily looked at her coffee. "I knew things weren't adding up. I didn't know specifically. I couldn't see Avery's case, but I kept the records because I thought someday it would matter. She paused. I'm sorry it took this long to matter. Carol was quiet for a moment. She would have liked you, she said, and the simplicity of it was sharper than anything else she could have said. She didn't have much patience for people who were full of themselves. She liked people who just did the thing, you know? Emily did know. The attorney says there'll be a trial, Carol said. Most likely. I'll be there. I know you will. They sat together for another hour, not talking constantly, letting the silences be what they were, which was not empty. Carol told her about Avery, about the warehouse job that Avery had been working while she finished her business degree online, about the plan she'd had, about what she'd wanted. Emily listened without trying to fix any of it, because there was nothing to fix, and listening without trying to fix things was its own skill, one she'd had to learn deliberately. When Carol left, she hugged Emily at the door of the coffee shop, briefly, the hug of someone who needed to make something real by making it physical. Emily hugged her back. She walked back toward the hospital in the November cold, the mountains clear today and white to the midline, the air sharp enough to make her eyes water. She thought about Avery Drummond, who'd had a plan, who'd been working toward something, who'd walked into a hospital after an accident and had not come out, because a man in a position of trust had decided that his financial arrangements mattered more than her life. She thought about what it meant to be the person in the room when everything depended on whether you knew what you were doing, and whether you did it, and whether you kept doing it even when the institution around you was making it actively difficult. She'd been asked a few days ago by a journalist who'd gotten her name through a source she hadn't identified what she would say to other nurses who found themselves in situations where they saw something wrong and didn't know whether to document it. She'd thought about it. Then she'd said, document it. Every time. Even when nothing happens. Especially when nothing happens. Because the record you keep when no one's paying attention is the record that matters when everyone is. The journalist had asked if she'd known, when she started the documentation, that it would lead to what it led to. She'd said no. She'd done it because it was accurate. That was all. That was all it had ever needed to be. The formal launch of the Redwood Crest Advanced Trauma Response Initiative happened on a Monday morning in February, 4 months after the events that had precipitated it. It was not a ceremony, because Emily had specifically asked that it not be a ceremony. It was a first training session, 6 hours, with 12 emergency department nurses and 4 attending physicians and 2 DoD medical liaisons who were there because the protocol framework Emily had developed drew on field medicine literature that required source-level clarification. Soren was there. Park was there. Martinez was there, which had felt, when she'd seen him come in and take a seat, like something completing a circuit. She'd spent 3 months building the curriculum. Not alone, with weights and with Soren and with 2 consultants she'd brought in from outside the hospital, including a flight medic she'd served alongside, who was now teaching at a military medical training facility in San Antonio, and who had driven to Denver for 2 weekends to sit at Emily's kitchen table and argue productively about pedagogy while rooks stalked around their papers and occasionally sat on the most important documents. The curriculum was not the version of her past she'd filed away. It was what happened when you took everything you'd learned in the harshest possible conditions and translated it into something a civilian clinical team could use in an environment that wasn't a tent in a forward operating base. It was the work of someone who had been 2 different people and had finally found the place where both of them were relevant at the same time. She stood in front of the training room on Monday morning and looked at the 12 nurses and 4 physicians and 2 DoD liaisons. And she felt the particular thing you felt when you were doing something that was exactly the right size and shape for the specific combination of things you were. We're going to start with autonomic presentation patterns in high acuity trauma, she said. This is not in your current protocol manual. By end of today, it will be something you can recognize and respond to. She looked around the room. Questions before we start? Priya raised her hand. She'd been one of the 12 nurses selected for the first cohort. Is it true you learned some of this in a combat zone? Emily looked at her. Yes. Cool, Priya said with the complete sincerity of someone who found this genuinely impressive and was not trying to be ironic about it. Emily almost smiled. Let's get to work. Victor Hale entered a guilty plea in March on the fraud counts and 2 of the clinical misconduct counts. The manslaughter charge related to Avery Drummond went to trial in May and concluded in 11 days. The verdict was guilty. Garrett Solis pled guilty in April to conspiracy and fraud charges and cooperated with the federal investigation into Meridian Strategic, which unraveled the procurement corruption case in enough detail that 3 other defense sector figures were indicted before the end of the year. Gerard Paulson resigned from the Redwood Crest board in February before the governance review concluded, which was understood by everyone to be an admission of something even if it wasn't legally one. Hale was sentenced in August. His medical license was revoked by the state medical board 2 weeks after the verdict, in a proceeding that was administrative rather than criminal, but that was, in its own way, more permanent. A man who had spent 20 years building a specific kind of professional life watched it be formally and publicly ended in a room with no drama, no audience, just a board and its decision, and the particular finality of a license number being struck from a register. Emily was not in the room. She was in a training session at Redwood Crest, working through a case study of a complex hemodynamic presentation with a new cohort of nurses, when her phone buzzed with Salas's message about the license revocation. She read it, showed nothing, put her phone away, went back to the case study. Later, when she was walking to her car at the end of the day, she let herself be, for a moment, whatever she actually was about all of it. She stood in the parking structure, the same one, the same fluorescent lights buzzing their specific frequency, and felt the weight of the year just past. The tire, flat on the ground, the suspension letter, the boardroom where Hale had made his phone calls through a door 2 inches open, Avery Drummond's photograph on her mother's phone, Carol's brief, real hug at the coffee shop door. It hadn't been clean. None of it had been clean. Not the investigation, not the legal process, not the hospital's internal reckonings, not even the good parts, which had all come with complications and incomplete resolutions and the ordinary imperfection of institutions run by humans trying to do better than they'd done. Real things were never clean. You did the thing anyway. She thought about the people who'd stood alongside her, not just Brooks and Achterberg and the federal machinery of it, but Donna at the nurses' station, Martinez with his voluntary incident report, Park's handwritten paragraph, Priya standing next to her for no clinical reason, just to stand there. The small, human, decidedly unceremonious collection of people who'd done what they could when they could. She thought about the thing she was building in that training room, the thing that would outlast the investigation and the sentencing and the news coverage, the thing that would be present in the hands of nurses who'd learned to recognize something they hadn't known to look for, who would be in rooms when it mattered and would know what to do. That was the real consequence, not the charges, not the convictions, not any of the machinery of justice that had ground through its process. Those were necessary, and they were right, but they were backward-looking. The training program was forward. She got in her car. She drove home through the city in the August evening, the mountains sharp and clear in the summer light, the sort of evening that Denver did well. Warm, but not punishing. The air honest about what it was. She stopped and got takeout from the Thai place near her apartment because she'd been too busy to cook, and she'd stopped apologizing for that some months ago. She fed Rook, who had opinions about the smell of the takeout, and expressed them until she gave him a treat, which she always did eventually, and he knew it. She ate at her kitchen table. She looked at the mountain photograph on the living room wall. She thought about the version of herself who'd walked into Redwood Crest 2 years and roughly 10 months ago, quiet and careful, and carrying a past that she'd decided needed to stay packed away, who'd been building a small, manageable, unremarkable life with deliberate intention and had not expected any of this. She didn't regret any of the choices that had led to it. She regretted Avery Drummond, but that regret lived in a different place from the choices. It lived in the place where she kept things she couldn't change, which she visited but did not live in. She thought about what Donna had said, standing at the nurses' station when she'd read the news report. There she is. That was it. That was the whole of it. Not a transformation, not a revelation, not the moment someone became something they weren't before. Just the moment when what you'd always been became visible. when the thing you'd been doing in the margins and the quiet and the careful maintenance of small, accurate records stopped being invisible and started being seen. Most of what mattered happened that way. Not in the dramatic reversal, not in the confrontation, not in the moment that looked like a climax from the outside. It happened in the documents kept when no one was watching, in the door pushed open when someone was dying, in the habit of writing things down because they were true, even when true didn't seem useful. She had not saved Marcus Voss because she was trying to be someone. She had saved him because she was trained and present, and the door was there. The rest had followed from that, from the simple, unglamorous fact of competence meeting the right moment. Nobody got to choose their moment. They only got to choose whether they were ready. She cleared her takeout containers. She made tea. She sat on her couch with Rook pressing his entire weight against her hip, as he did when he'd decided the evening was for staying and not for anything else. And she opened her laptop and looked at the curriculum for next week's training session and started thinking about how to make one section clearer. Outside, Denver was doing what it did. The mountains were there in the dark, where they always were, unchanged and very large and thoroughly unconcerned with the small human dramas happening at their feet. She worked until she got tired. Then she closed the laptop, turned off the light, and let the day be done. Tomorrow there would be patience. There would always be patience. And she would be ready, the same way she was always ready. Not because she was exceptional, not because the story had gone her way, but because she had spent years making herself into someone who knew what to do when it mattered, and she had not let anyone talk her out of that. That was the only power she'd ever needed. It had always been enough.